Another content on the NCLEX exam is what? Mandatory report, right? You will get this content under be it management of care or coordinated care, or you're going to get it under psychosocial integrity, right? So mandatory report. So you can get it tested under this area. Management of care is for registered nursing. Coordinated care is for PN, psych for both registered nursing and PN. So mandatory report, you need to know that. So what you definitely need to know about mandatory report is what I'm going to give to you. All I do is to give you straightforward information, right? So mandatory report, you have to report this by law, right? That's what you need to know. So what are those things you are reporting by law? These things, you don't keep them confidential. You don't need the patient to tell you to you don't need the patient how do I say it? Like you don't need the patient to you don't need to ask for patient consent before you report this information. Right. You don't need to ask for patient consent before you report this information. You can report this information without the patient consent, right? Because you are going to report this according to what? The law. So yes, now you want to report what? Abuse, neglect, right? You can take time to read this information. You want to report what? Infectious disease such as TB, hepatitis, HIV, COVID, some certain STI, measles, right? That's what you want to know, right? So yeah, you want to report all these things, right? For your abuse, neglect, child abuse, elder abuse, vulnerable adult abuse, right? Even if you are just suspecting, even if you are just suspecting, you need to report. That's what the NCLEX wants, right? You want to report impaired workers, workers that are using drug, alcohol, or doing unsafe behavior. So if you see a nurse, right, diverting meds or smelling of alcohol, you want to report that. Very important. A lot of students always used to ask, who are you reporting the situation to? Now, all you just need to know on the NCLEX exam is this. NCLEX is not difficult. Now, once you've seen all this on the NCLEX exam, right? You know you need to report this, right? So just look for that answer that talk about report. NCLEX will include who you are to report it to. NCLEX don't test who is the right person to report it to. NCLEX just wants you to report. So they are going to include who you are going to report it to. So yes, that's that for that. Now, gunshot, stab wound, violence injury, you want to report that. You understand? Even if the client refused to disclose attacker, you want to definitely report that. So that's definitely what you want to know, right? So NCLEX want you to report immediately, even if you don't have proof. You are just suspecting, report, especially for abuse. Now, you need to follow chain of command, but NCLEX will not likely give you chain of command, right? Is either a chain of command report or facility protocol when you are trying to report, but NCLEX will not likely tell you, okay, should you report to the charge nurse or you should report to the public health when it happen to be issue with maybe TB. No, NCLEX will not likely give you that, right? So, but NCLEX is going to give you answer related to reporting to chain of command or facility protocol. So NCLEX can either put charge nurse or put public health when it comes to reporting TB. So take note. Now, do not try to confirm the abuse yourself. Do not delay to see if it gets worse. Do not notify the family before reporting, especially in abuse cases. So if you see those kind of answers that is telling you to either confirm, abuse yourself, or delay, or trying to tell the family member about it, no, we don't do that. Now, sample question right here. Now, the nurse suspects that an elderly client's bruises may be due to physical abuse by a caregiver. Which of the actions should the nurse take? Ask the family member privately if they are responsible. No. Document the concern. We want to report. We want to do something about reporting before we even think about documenting. Report suspicious. Correct. Wait to see if the client develop More bruises? No, that's wrong. So your answer is 3. Right. So that's the sample question that tests you on mandatory report. So some word you need to watch out for that speak about some issues, right? Unexplained bruises or injury, history of inconsistent with history inconsistent with injury, clean, fearful, or withdrawn. Nurses smell alcohol on another nurse breath. Gunshot wound not reported to police. Child with STI or poor hygiene. So these are what you need to watch out for. Once you see all these kind of statements, you know you need to do the needful by reporting the situation, right, to the necessary person the NCLEX talk about. But this is what is very important for you, right? On the NCLEX exam, you want to know you report this, and these are situations surrounding it. You want to know you report this, and these are situations surrounding it. You want to know you report this, and these are situations surrounding it. You want to know you report this, and these are situations surrounding it. So once you know that, once you see your NCLEX question and it's talking about any of this, just look for that option that talk about reporting. So yeah, that is it.